Hello, my name is Vitasha McCone. I am in the online MLT to MT program. This is my microbiology case study. I chose to do my bacteria on strep agalactae, group B strep. Okay, my patient information is a 35-year-old female tested positive for group B strep at her 34-week appointment. The organism identification was beta hemolytic streptococcus. Group B strep susceptibility reflex was clindamycin resistant. It was identified as strep agalactae. Um, the 35-year-old female with an intrauterine pregnancy checks out into the hospital with spontaneous rupture of membranes confirmed by a nursing examination. She was noted to be dilated 4 centimeters and upon repeat examination revealed meconium to be present. An intrauterine pressure catheter was placed and an amnio infusion was started to try to flush out the meconium so that the baby wouldn't go into distress or ingest any of the meconium. At this time, she was given antibiotics and started on ampicillin. She was given the choice whether to proceed with her natural labor or to be moved to C-section due to the fact that she was group B strep positive. She also had a she was also I'm sorry. She also had gestational diabetes and had other issues throughout the pregnancy. After consulting with her doctor, they decided to go ahead with the C-section. But before being able to go into surgery, she had to receive her antibiotics due to the group B strep. The causative organism was group B strep, strep agalactae, which can cause premature rupture of membranes by infecting the amniotic sac and the surrounding tissues of the membranes, which can then rupture before the onset of labor. Strep agalactae is a gram-positive, catalase-negative facultative anaerobe. In a prospective study of colonization with group B strep among 6,706 participants, they found statistically increased incidences of premature rupture of membranes and preterm delivery at less than 32 weeks of gestation among women colonized with group B strep. Premature rupture of membranes occurred in 8.1% of the total population, but in 15.3% of the colonized population, but among 5.4% of the women colonized with group B strep. The data suggested that a causal relationship between group B strep colonizations and events leading to the preterm birth. The possible impact of eradication of colonization with group B strep on prematurity is considered. If a mother is positive for group B strep and not treated, it can cause all kinds of issues with the baby. It can lead to meningitis, sepsis, pneumonia, DIC, a host of other issues. All mothers are tested for group B strep, usually between 34 to 36 weeks. This particular case study is actually my own. All this information was found in my MyChart. I was 34 when I was pregnant with my last child, and I had a lot of issues, but I was positive for group B strep, and I hadn't been positive with my other 2 pregnancies, to the point that my urines were all positive with greater than 100,000 colony forming units. I kept urinary tract infections. I just stayed really sick with it, and this is why we believe that my water broke prematurely at 36 weeks, causing me to have my baby prematurely. Thankfully, she was fine. She'd been given steroids for lung development, and luckily we had kind of foreseen some things happening and was able to treat that, but had a great OB. But this is not uncommon for women who have group B strep to have premature rupture of membranes. It causes the amniotic sac to break down, the membranes to break down, and the fluid to become infected. It puts the baby in distress. In this case, Daddy the mother, which was me, tested positive at 36 weeks, causing me to deliver prematurely. The baby was in distress, which is why there was meconium present. I had to have the antibiotics before I was taken back for my C-section. My references are all in my chart. This is all information I got from my chart. And the other one was an article that I read on premature rupture of membranes and preterm delivery and group B strep, colonization of mothers. Thank you guys for listening to my presentation. If you have any questions, feel free to ask. Thank you.